Okay, hopefully everybody's managing to join us and that you can all hear me. My name's Julia Harris. I'm the admissions tutor for children's nursing here at London South Bank University. So I'd like to welcome you this afternoon to this presentation about our children's nursing course. So thank you for attending and thank you for choosing London South Bank University as one of the universities you'd like to come and study at. So this is specifically for those of you who have decided to choose children's nursing as a career, or for those of you who are not quite sure which field of nursing that you'd like to go into, or you're just really not sure and just want to find out a little bit more information about the nursing courses and the healthcare courses that we offer. Hopefully, I'll give you lots of information, but there will be some time for you after the presentation to ask me any questions on the chat. So I will answer those after, but if you want to write them in as we're going along, that's absolutely fine. I can't see them at the moment, but as soon as I finish the presentation, I can answer those for you. So welcome today. So this is my email. If any of you have anything you want to email me or you think of any questions afterwards, then please do. Nice easy one to remember, julia.harris@lsbu.ac.uk. It's great to have all your questions answered when you're applying or before you're applying. So within this presentation, I'm going to talk about the courses that lead to registration as a children's nurse, as we also have, as well as the Bachelor of Sciences programme, the postgraduate diploma and our MSc pathway. Talk a bit about the entry requirements, which you may or may not have seen on our website, and how we assess those entry requirements in our interview process. Talk a bit about the course and what that course looks like across the 3 years. We also offer neonatal and community pathways to those applicants who specifically want to focus on more neonatal or community, or if that's something that you feel that you're interested in. And those are unique to us at London South Bank University. I'll also let you know which hospitals we're affiliated with and where you might have placements. We've got lots of support services here at the university, so we'll talk a bit about those. And really understanding what children's nursing is and what we do as children's nurses. Just to give you a bit of background, I've been a children's nurse now for 22 years, predominantly in paediatric intensive care. I also have a keen interest in research and clinical trials as well, so do a lot of the research module teaching and clinical skills. We have a very varied team in terms of skill sets, so some from general paediatrics, some from the community, some from more acute A&E, and some specialities like oncology, for example. So we're a very wide, varied team. There's 18 of us in our team. We also have two neonatal specialist nurses as well. So we come with lots of diverse backgrounds and different stories that we let you know about in class. So part of our course, it's obviously a professional course. So part of what we assess is your professionalism whilst you're on the course in the university as well as out in practice. We are under the Nursing Midwifery Council, and we have a code that we have to follow, and they also specify those competencies that you need to have at the end of those 3 years. So we have to make sure that we are delivering those and teaching those to you so that at the end of it, we can say that, yes, you meet the NMC requirements for being a newly qualified nurse and that you're competent within that as well. So you're assessed in placement and you're also assessed in the university as well. So it is a professional course. It's a very busy course. Unlike some other courses at the university, you are in Monday to Friday, generally 9 till 5. Wednesday's normally a day off in terms of it's a health and wellbeing day. So that's a day we encourage you to do some extracurricular activities that you have a bit of downtime. But most of the time you're in at least 3 full days a week in the university when you're on university time. So it's a very busy, very full course and needs lots of organisation. So the courses that we offer here are the Bachelor of Science programme, the Undergraduate Bachelor of Science programme, which is the 3-year course. We also offer a postgraduate diploma for those nurses that already have a degree, and that's a 2-2 and above. And that can be in any subject, but that's a 2-year course. And also as part of that, or alongside that with the same course, is the Master's MSc. So postgraduate diploma and the Master's programme is the same. You'll be in the same class. The difference is in your final year, your second year of the Master's pathway, you will do your dissertation. And we also have a registered nurse RN child pathway, which is for those nurses who are adult trained or trained in other fields, learning disabilities, mental health, who want to also become a registered nurse on the NMC register as a children's nurse. So we offer that, and that's generally a 1 year to 18-month course. The entry requirements, you may have seen those on the website, but it's good for us to talk through that. So we're working at 112 UCAS points, so that's, as an idea, A-level, BBC. However, if you have your predicted grades and perhaps they're lower than that, slightly lower than that, and please do still apply. We consider all of our applicants on an individual basis. We also require 2 GCSEs at grade 4 and above, which are maths and English. Or you may have access to higher education diploma in nursing with 15 distinctions and 30 merits, and functional skills level 2 numeracy and literacy. So you're either required to have the GCSE maths and English or functional skills level 2 numeracy and literacy. If you're wanting to enter onto the PG DIP MSc pathway, then as I said, it's a bachelor degree 2 and above, plus your maths and English GCSEs grade 4 or equivalent, or again, functional skills level 2. We also require, as part of those programs, you to complete a recognition of prior learning package, which includes you telling us a little bit about any work experience that you have that is relevant to nursing, and you will have an online day that tells you all about the recognition of prior learning practice and what the requirements for that are. So if you've had customer service experience, for example, that's transferable skill into nursing. And then we also require you to complete a life sciences workbook, because as it's a 2-year course, what you're essentially missing is the basic anatomy and physiology modules that they do in the undergraduate program. So there's an expectation that you will have an understanding of basic anatomy and physiology, and your first biology modules are the applied pathophysiology. So we start to learn about illness and how that affects the body. The other part of the entry requirement is we conduct interviews, and in those interviews we are assessing really good health and character, those capable of safe and effective practice, and that the personal values that you have align with the values of the NHS, the NMC and the university. So if you look on the NHS England website, you will see that they have some values set out, and it's about honesty and integrity, kindness and empathy, problem solving skills. So the questions that we pose to you in those interviews are probing you to find out what your problem solving skills are like, and how you react in certain situations that will be real life situations that you might encounter in the university or in the hospital. And of course, we require a satisfactory reference and a personal statement as well. So really be considered when you're writing that personal statement, what, really sell yourself in terms of why you want to be a nurse, what you bring to the nursing course, what you know about it. For us, an interview, if somebody can demonstrate that they have a passion for children's nursing, and we can see that you've gone away and you've looked up and understood what a children's nurse is, that's really important for us, that you can demonstrate that you know what the course is about, you know some of what it means to be a children's nurse, you've thought about some of the challenges that may come up whilst you're on the course or out in placement. Because it is a very rewarding role, being a children's nurse, but it's also a very challenging role as well. So it's we want you to demonstrate that you've thought about that. The course itself is split into 2 semesters. This is for the pre-reg BSc. This is kind of an outline of what it looks like across those 3 years. 50% of the course is spent in theory and 50% is spent in practice. And we do that in blocks. So as you can see in year 1, for the first 10 weeks, you're in university. And that's quite nice because it allows you to get to know each other as a cohort. It lets you get to know the lecturers, your way around the university. And if you've moved away from home, it gives you a settling in period before you go out on placement. We also have quite a lot of things to do before you go out on placement. You need your uniforms, You need to have occupational health sign off as fit to go out to practice, and you also need to get your certificate from the barring service as well to say that they're happy for you to go out in practice. So there's a lot to do in that first semester. And of course, at the end of the semester, you'll have assessments. So that will be an exam and an assignment at the end of the first semester. And then you have your practice. You go about mid-January to your first practice placement. So our students currently in the first year have just finished their final week of semester 1, and they're having a little break and revising and writing assignments prior to their proper Christmas break. And then they will be coming back into semester 2 and going out onto placement. And as you can see, it follows that pattern throughout the years. If you look at the year 3, you have a big placement at the end of year 3, and that's called your sign-off placement, which is a 12-week placement. And that is where you are assessed in practice as being competent to be put on the Nursing and Midwifery Council register as a children's nurse. You are assessed at the end of each year in terms of whether you've passed everything, and then there's a progression point into the following year. In terms of the course each year, the academic level increases. So for Bachelor of Science, year 1 will be at level 4, and that's really about describing things. Year 2 is level 5, which is about being more critical in the way that you think about things. And in year 3, you'll be at level 6, which is about the critical thinking plus the synthesis. So being critical and then explaining what the information you're trying to get across to us, what that means for your patients. So if you're writing an assignment about a particular topic, you're demonstrating all of the information, you're being critical of that information, but you're telling us, well, what does this mean for my patients, or for me as a practitioner, as a staff nurse. Postgraduate diploma obviously is a high level. Again, level 6 is about that critique and synthesis, and at level 7, which is master's level, that's more developed. We expect you to be a lot more succinct in the way that you write. But you are fully aware and fully critical and fully able to synthesize what the information means. As I said, 2 semesters per year. There's usually 3 modules per semester, so 6 per year. Most modules are 20 credits, although there is a skills module which runs throughout the whole of each year, and that is a 60 credit module. So, for example, in the first semester of year 1, you'll have biosciences, again, which is a module we call a long thin module, which runs across the whole year. So that's your basic anatomy and physiology. Also in semester 1, you have your communications module, which talks to you about verbal, non-verbal communication, very, very important skill in nursing, and also your skills module, which runs throughout the year as well. There's a variety of academic assessments at the end of each semester. So it may be assignments, it may be exams, it may be something called an OSCE, which is a face-to-face examination. You can see on this picture here, 3 people, they're doing examination of a patient. So some of our OSCEs involve you assessing that patient, and that's a year 3 OSCE. But we also do pharmacology OSCEs as well. And on occasion, we do academic assessments as poster presentations as well. And there's continuous assessment of your practice, your clinical practice. When you're out in placement, you have a competency book, which is an ebook. So it's an online competency document that yourself and your practice assessor, which is somebody that you're assigned to out in placement, will complete together. You normally have a practice assessor and a couple of practice supervisors when you're out on placement. So that you know who you're generally working with on a day-to-day basis, and somebody that's overseeing you as a student and is assessing your competency. You're in the university for 46 weeks per year, so it gives you an idea. We do give you holiday and some downtime, but I can say to you now that our first years are quite tired at this point in the year. It's sort of a long 10 weeks. There's a lot of information at the beginning, so kind of prepare yourself for that. In terms of the modules, I sort of shared a few that we do in the first year, but they follow these kind of themes. So anatomy and physiology. So you'll do your biosciences, which is, as I said, your anatomy, basic anatomy and physiology. And then in the second year, it will be more of applied anatomy and physiology, pathophysiology. So what happens in illness, what happens to the body in illness. And then in the third year, it moves on to pharmacology and how drugs act on the body. Clinical practice skills, as I said, throughout the 3 years. We do a lot of interprofessional collaborative practice in healthcare modules as well, which is really important that we understand adult nursing, mental health nursing, and learning disabilities nursing. Obviously, as children's nurses, we look after children from the age of 0 to 18. So, it's across the spectrum. We will have children who have learning difficulties, children who have mental health issues, and also our older children are essentially going to fall into the realms of adult care. So it's important that we have that interprofessional and collaborative learning across the fields. We also have modules that talk about health promotion and public health across the 3 years, and our evidence-based practice. You currently have a research module each year, and that's getting you to think critically about what you do and to make sure that the care that you're giving is of the best quality and is evidence-based. Now, I mentioned at the beginning there, we offer these pathways, which is quite unique to London South Bank University. Now, not every hospital that we are affiliated with offers this. So when you do come to the university, when you're allocated to your trust, it may or may not be that they offer the neonatal pathway. But when you start, you are asked to submit a small piece of writing as to why you would like to be on the neonatal pathway. Now, what the neonatal pathway means is you won't come out with a neonatal nursing qualification. You will still come out with your children's nursing qualification. But on your CV, you can write that you were on the neonatal pathway as part of that. And the idea behind it is it prepares you for a future in neonatal nursing. So it's something you think you're really interested in, it will definitely be worth you doing that, or something you think you might be interested in. It doesn't mean if you don't go on the pathway, you won't have a neonatal placement, but it just ensures if you are on it, you will have a placement each year in the neonatal setting. So generally speaking, depending on what the hospitals offer, first year will be something along the lines of special care baby unit, year 2, high dependency, neonatal nursing unit, and in year 3, it will be more of a intensive care setting. So it kind of steps up each year. There are a limited number of places available on the course, which is why we ask people to submit why they want to do that particular pathway. So that's really interesting. And also you will have an extra study day each year from one of our neonatal nurse specialists, preparing you with specific information about that. We also offer a community pathway, and this is just at one of our trusts, which is Guy's and St Thomas's, which has a big community team that actually sits within the hospital, and they have lots of community specialities across there. So you get a wide variety of experience across community nursing there. And of course, more care is being delivered in the community. So it's very topical at the moment, this increase in community care. And again, it follows a similar theme in the fact that you have 3 community placements across the 3-year course, 1 in each year. And again, there are, as this is only at one trust, a limited number of courses, a limited number of places on the course. But again, that's something we will ask you to express an interest in. Practice placements occur across a variety of settings. It's mapped out by the educators within the trusts as to where you will go. They will ensure that it's very limited in terms of you going to the same place. They will always make sure that you go to different places where possible within the hospital. So it could be day surgery wards, outpatients departments, which tend to be more in the first year. And then second year will be more ward-based placements, A&E theatres, community placements tend to come up in the second year. Could be an adolescent unit if they have that at the particular hospital you're at. And then neonatal or paediatric intensive care areas tend to be second and third year as well. Of course, thinking about placement as well, the hours that you do on placement will mirror those of the nursing staff, which are generally 11.5-hour shifts, so those long days. And you will do in a 4-week period 13 shifts, and that can be days or nights. Some trusts are kind in the first year, they might only give you 1 or 2 nights, but it very much depends on what your practice assessor and practice supervisor are doing, because we like you to work with them as much as possible so that you've got continuity with somebody to assess your practice. These are some of our hospitals. So we have a wide variety of hospitals, large teaching hospitals, district general hospitals, and they are all fantastic hospitals. And they all offer great experiences, great support, great education teams within them as well. We work incredibly closely with them all of the time. So as you can see, there are specialists. So some hospitals have paediatric A&E, some hospitals have more specialist areas like Great Ormond Street. Chelsea and Westminster have got a burns unit, which is very unique. Here, UCLH do a lot of oncology and adolescent care. Evelina, you've got cardiac, renal speciality. King's, you've got the liver unit there. So, lots of things going on. Barts, they've got neonatal intensive care unit out there as well. So we have a huge amount of providers. In terms of placements, we look at your term time address, and you're allocated so that you're not travelling more than an hour and a half each day to your placement area. Hopefully it'll be a little bit less than that, but just be prepared for that. If you're on a community placement, they can be a bit further away because they're a bit more spread out. So I'm going ahead of myself here, but yes, so shifts are say 11.5 hours, but it's 12.5 hours really with your lunch break. It does include working weekends, night shifts, religious holidays, bank holidays. So, really be aware of that. Don't let that be a surprise to you when you start at the university. You're expected, as I said, to mirror the shifts that the qualified nurses do. So there will be some unsocial hours. In terms of the support services that we offer, we have a lot of support services here. We have a very diverse student population, and we're very proud of the support services that we have to enable everybody to be successful at the courses we offer. We have an education development centre. So if you feel you want extra help or you're just not sure about something, there are services that you can access there. We have a student wellbeing service. Lots of things can happen in the time that you're here at the university on your course. Life is happening in the background. So whether you need extra support from a wellbeing perspective, from a mental health perspective, then we have a team that can support you there. We also have occupational health. So if anything is to unfortunately happen whilst you're here, we have continuous assessment by occupational health to make sure that you're fit to go out into placement and fit to be in the university, or if we need to make any reasonable adjustments, we can do that. We have a student support service and DBS advice. So if you have dyslexia or disability, then again, it's about having an assessment and seeing what reasonable adjustments we can make to enable you to progress in the university environment. And lots of support from us as the lecturers. We have other roles as well as teaching you. You will be allocated to a personal tutor who will stay with you throughout the 3 years. They will meet with you generally after every placement, but they are there as a person for support, what we call pastoral care. So if there's anything that is stopping you from reaching your potential, whether that's something happening at home, whether that's something that you're just finding difficult at the university, then they're the people to talk to. We may not always have the answers, but we can certainly point in the right direction as to where to go. Your personal tutor will know about you across the course academically and out in placement as well. So they're the people that generally will know you well. Cohort leader is like a year lead, a head of year. So they look after you as a cohort, as a group, and they will meet with you very regularly when you first start as a cohort. You will vote for 2 people in your cohort to be the cohort reps. So anything that is happening within the cohort that you want to bring to the year lead's attention, then those are what those meetings are for. You have course directors, or course leads as they're now called, who are head of the course, head of all years essentially. And we have lots of administrative staff as well. Obviously, we've got placements, occupational health, DBS service, people sorting out examinations. So, lots and lots of people making things work behind the scenes in the university. So there's lots of support around. As long as you ask, it's there. We even follow you out on placement, so you can't get rid of us essentially. So when you're in placement, you will have a link lecturer. So we're all linked to a particular hospital. I'm linked to Chelsea and Westminster Hospital, and we will come and see you every other week when you're in placement. We'll either do that online or we'll do that face to face, just to see how you're getting on, making sure your competency book is being filled out, and just helping you with anything that any questions you might have or any difficulties you might be encountering. There are education teams in every hospital, and they will also be supporting you and making sure that the placement's going smoothly, or if there's anything you particularly want to see or learn, they can help sort that for you. Talking a little bit more about the recruitment process, as I said, so some of you will have already applied through UCAS, some of you again may be deciding on where you're going to apply to. So you'll be shortlisted on your academic entry qualifications, as I talked about those earlier and again on our website. But as I said to you, if you maybe haven't been predicted to get 112 UCAS points, please still apply, as we are considering applicants on an individual basis. You'll be shortlisted as well on your personal statement and reference. That's why I said it's really important that that personal statement tells us about you and your passion and your interest for children's nursing. And obviously a reference, which some of those will be from your colleges. Normally we want an academic reference, or your schools. And then we'll do this values-based interview that I talked about. So the NHS Constitution and our LSBU values are very, very similar. So we're looking at demonstrating your demonstration of quality of care, compassion, that we're improving lives, trying to improve quality of life, that you work together, so very much about team working, that the patient and family are at the centre of everything that we do. We treat people with respect and dignity, inclusivity. We're able to be creative and problem solve, professionalism. So these are all really important things, and things that we try and draw out in that interview process. So just have a think about those if you're coming to be interviewed by us in the coming days and into next year. So we assess communication and interpersonal skills. So we very much from the beginning of the interview, we're sort of assessing you as a candidate. And as I said, the questions look at your demonstration of honesty and integrity, intellectual curiosity, the ability to advocate for your patients and stand up for the rights of others, demonstrating respect for privacy and dignity, for difference and diversity, demonstrating kindness, compassion and empathy, and that you're able to show initiative, problem solve, talk about team working, and that you have an understanding of the role of the nurse. And sometimes that's the big question that we expect people will be able to answer, that sometimes they can't. So really going away and having a look and thinking, well, what do children's nurses really do? There's lots of nice YouTube videos that talk about nurses and what nurses do. So try and really come with a real understanding of the role of the nurse, and that you've thought about some of the challenges that you might face as a student nurse. So nursing, essentially, I always say us as children's nurses, or nurses just generally, is that, you know, we're trained to observe. We have very acute observation skills to pick up those changes in our patient's condition. I am very passionate about children's nursing. I've been very, very privileged to work in fantastic hospitals and have learned such a great deal in my career, and there's still so much that I don't know. And that's what excites me about nursing, is that there's always something to learn. Once you're a children's nurse, there are so many different roles that you can actually go into. When I think back to when I started as a children's nurse, you know, I wanted to become obviously a senior staff nurse, and that was my aim. I was interested in education. I'd done some educational support roles with students and became a clinical educator. And then an opportunity for research came up, and I was thinking of doing my master's. So, you know, you can go in very different directions to where you thought you might go. But once you've got that qualification, it really opens up the world in terms of what you can do within children's nursing and what path you may take. But generally speaking, if you had to put nursing into a nutshell, it's about the use of clinical judgment in order to provide care, to enable people to improve, maintain or recover their health, or to cope with health problems and achieve the best quality of life, whatever their disease or disability, until death. So, you know, we look after across the spectrum. We look after those that are just born, and we do care for those at the end of life as well. So it's a very diverse, very large role in terms of what we do. As I said, we look after children from 0 to 18 years and, of course, support their family, including the parents and carers. A very, very big part of the role is family support. So what do nurses do? Well, this is the nursing process, so it's very much in a nutshell. So we do a lot of assessments. Obviously, in the first year, in that first semester, you will learn about vital signs and observations, and all of the types of observations we do and when we do them and why we do them. Really, really important. So we're assessing our patients and we're assessing them constantly. We're finding out what they need. When we found out what they need, we plan what we need to do. And then we implement that plan, we give that care. And then, of course, we have to evaluate to decide if that care worked or we need to do something else. And this is the constant process that we are following through our nursing care. Of course, we want to meet our patients' needs, and we ask patients what they want their nurses to do and what they want their children's nurses to look like. Well, they want them to have a positive attitude. They want them to be positive. They want to be comforted. They want that physical comfort. They don't want to be in pain or to be uncomfortable. They want entertainment and humour. You will find yourself doing some of the strangest things to try and distract a child or to inject some humour into a situation sometimes. They want you to advocate. They want you to speak for them or speak on their behalf. And that's not just the children. Sometimes that's the parents when they feel unable to do so. They want you to provide for their basic needs. So making sure they are fed, making sure that they are dry, their nappies changed, and that they're clean and they're washed, and that their medication is on time. Providing for their basic needs, that they have comfort and care when they're upset. They want to be acknowledged as individuals. They want us to reassure them, and they want these nurses to be very good at their job. Medication given on time. They want you to be clean. They want to see you washing your hands. They want you to be nice and calm, speak kindly, be kind to each other, and to be well organised. So I think, they're all great things that we would expect our children's nurses to demonstrate at the end of this course. Thank you for listening to the presentation. I hope you found that useful. And if you have any questions, then please do write them in the chat and I will answer as many as I can with the time that we have. Thank you very much. Oh, the hospital at the bottom. Hold on one second. Let me just scan back through my slides and I can let you know. The one down the very bottom was Kingston Hospital. So when you're off on annual leave, so you have holiday within the course plan, so you have 2 weeks off over the Christmas period, then no, you don't have to work during that time, just work during the allocated time for placement. So just when you're out on placement. You do have some weeks that are called study weeks, and that's when you're consolidating your learning or writing your assessments and assignments. So you have, in the first year, you have 2 weeks at Christmas, and then you have an Easter break. And then you have a longer holiday in the summer. You have 4 weeks in the summer, which is basically the whole of August. But as I said, you do have study weeks here and there, although you are officially in the university. So you do need to be available. Any other questions at all? So thank you, Jennifer. So for the master's program, you need to have 2 or above degree. And then you will be required to complete the recognition of prior learning. So this is a document where you need to demonstrate that you have a certain amount of hours that are sort of relevant experience to the course. So it may be that you've done some work in a hospital as a healthcare assistant, or you've volunteered, or you've been working in a role where you are customer facing, customer service role. So anything that has a transferable skill. Now, what we do when you apply for the postgraduate diploma and or the MSc is you will be offered a session to come for a session that talks to you about the recognition of prior learning and exactly what you need to write in that documentation. You will also need to have from that work experience, the person who was your manager or your line manager or supervising you needs to sign off that you have certain professional values. And that is, you maintain confidentiality, you're professional, and you also need to complete the life sciences workbook, because in the past we used to only accept students who had degrees that were science-based, but we don't do that anymore. Any degree is accepted because obviously you can study at that level. But you have to complete the life sciences workbook because, as I said, you miss the basic anatomy and physiology component. Although in the pathophysiology module that we do in year one, because that's my module, we do go over some basic anatomy and physiology, but very briefly. So the average learning day at university is normally 9, 9:30 start. And then you will normally have blocks of teaching. It does vary, but normally an hour and a half, and then you will have breaks. You'll have a break in the morning, lunch break, and a break in the afternoon. Most days go on to about 4. And it's a mixture of face-to-face lectures and can be seminars, which is where you do more group working, where the lecturer facilitates and discussion. So we tend to do more lectures in the morning and more group work in the afternoon, because we feel that in terms of concentration, trying to concentrate all day can be quite tricky. So it's good to break up and discuss and think about what you've learned in the morning and the afternoon. Sometimes we do self-directed learning, where you'll do some work at home, or you may go off in groups and do some work and bring it back for presentation the next week. And sometimes, most of our teaching is face-to-face, but sometimes for the bigger modules, the interprofessional modules, some of those sessions may be online via Teams platform. So that would be your average kind of day at university. So they are very full days. You will get your timetables when you enroll, and you will be able to see what your day looks like and where you'll be at any given time. Your placements, they are allocated to you based on your term time address. Obviously had lots of trusts, but we don't just have our students at one trust. There's students from different universities at the same trusts. So they're allocated, as I said, based on your term time address. So, you might want to have a look if you're coming into halls. Most of your, most of the big inner city London hospitals will be within your travel distance. But if you're, if you're living out in Essex or East, you may find that you're more in sort of Barts, Royal London, Barking, Havering and Redbridge. So have a look at where your term time address is and look at the hospitals we're affiliated with, and you can see potentially which hospitals you'll be based at. We do ask you when you start that if you are at a hospital where you receive treatment currently or a family member does, that you're not allocated to that placement area, just for purposes of confidentiality and for blurring lines and potentially working with nurses that have looked after you in the past. Yes, there is opportunity to view the university. We have open days. We have 2 coming up. We have our next one is in February. They're always on a Saturday. And sorry, I'm just looking up the date. February of the 24th, I believe. Yes, the 24th of February is our next one. So please do come along. On that day, you can have a tour. You might want to come to this presentation again, or you can come and meet us at the desk and ask any further questions you have. But definitely, if you can get down to see the university, have a look around, have a look at our facilities, you would be very welcome and encouraged to do so. Is there homework? Yes, we call it blended learning. But yes, there is homework. We don't always check up on whether you're doing it. The idea, obviously, behind university as adult learners, you are more self-directed. So when you are presented with, some teaching that we've done during the day, we have a Moodle site, which is an online virtual learning system. You will go onto that and all of the slides will be there from what we've done in class. There'll also be a section called blended learning, and that is to support what you've learned and help you build, but also help you identify the gaps in your knowledge. So when you come back the following week, you can say, Julia, I know we talked about asthma last week, but I don't quite understand the inflammatory process part of it. So could you explain that again? So the idea behind the blended learning is that it helps you, consolidate your knowledge, but also where the gaps might be so that you can come back and get the most out of your lectures. Enrolment is in, so you'll normally get, if you've come through the main cycle and not clearing, you will get an enrolment email generally at the end of August. And then Freshers Week is normally the 12th of September, so around that time. So enrolment normally happens over that first period where you'll have to come and present your certificates and go through that enrolment process. The deadline for applications. So at the first round, the deadline for applications is the end of March, but we do process applications throughout the year unless we are closed to applications. So the earlier you can get them in, the better. Otherwise, you do risk missing if we do get full. We only have, I'm just trying to think, on the MSc pathway, I think we have 16 places. How many exams per year? So year one, there's 2 exams. There's 2 exams in year one. I think there's 1 in year 2. But obviously you have your OSCE face-to-face exams as well. And there are 2 of those in year 3. All great questions. Anything else you'd like to ask me? So facilities on the campus, we have a brand new building called the Hub, where we have a lot of our lecture theatres in there, and our big, lovely, brand new library that we have there as well, which is a really nice space for studying, as well as obviously having hardback books, but you cannot get a lot of ebooks online as well now, which students tend to do. We obviously have our skills labs, so we have a number of them set up as hospital wards essentially. We have our mannequins, so we have a new one called Aria. It's a simulation doll, her eyes open, she talks to you, you're able to listen to her lungs, hear her heart beating. So we use her a lot when we're doing some of the simulation sessions, but we spend during your skills modules, which across 3 years, we spend some time in the skills lab practicing things, passing NG tubes, feeding each other, brushing each other's teeth, so that you get to know what it's like. You'll do your manual handling and basic life support training as well in those rooms, where you'll get to hoist each other and move each other around the bed. And of course the mannequins for basic life support as well. So lots of sort of chances for practical skills to be practiced essentially. Absolutely. We have lots of lovely places to eat, have your lunch, lots of new places. We have a Costa coffee. We're obviously in the centre of London, so the transport links are fantastic, and there's lots to do around and about as well. And again, in Freshers Week, there'll be tours of London and the local area. So if you are new to the area, then there's lots of opportunity. We also have a lot of student student activities in terms of groups. So whatever you're interested in, rugby, football, ice skating, running, walking, religious societies, study groups. There is lots going on all of the time, and that again, those Wednesdays are the days that we really encourage that. We have a gym on site as well, so there's lots of activities for downtime as well. Structure and modules for the MSc. So as I said, the MSc is a 2-year programme and you study alongside the postgraduate diploma students. The only difference being that you will do the MSc. So you again have a skills module that runs throughout the 2 years that you have. Your first modules, you also have research modules each year. And you'll do anatomy and physiology, pathophysiology for children and young people is one of the first modules that you do in the first year as well. And then pharmacology in the second year follows on from that. And as I said, you will do the MSc dissertation. Now with the MSc dissertation, you'll be doing that alongside 2 other modules. So it's quite busy at the end of that second year for those master's students. So just something to think about in terms of planning. With the master's dissertation, you're allocated to a supervisor who is obviously studied to master's level themselves. And you get 9 allocated hours to spend with them so that they can support you through that writing period. As I said, the dissertation module is a taught module alongside that. And you also have your placements. So it's quite a busy 2 years for the postgraduate diploma and the master's. But our students really enjoy it. It's a really nice group. It's obviously a smaller group of students that are doing that course as well. It's not compulsory to complete Freshers activities. Freshers Week, there's a variety of things that go on in Freshers Week. But also you have induction in your first week as well. So there'll be days when you're actually in the lecture theatres learning all about the university. So we have finance come and speak to you. We have the placements team come and speak to you. Health and wellbeing come and speak to you. And then we talk to you about more specific things to do with the children's nursing course. You'll meet all of the lecturers and we'll be preparing you essentially for university life in that first week. You'll have lots and lots of information. The Freshers activities, you can choose whatever you fancy doing. There's lots of activity going on around the place. There's stalls set up. The societies are all there. So we do have a nursing society. I didn't say that. So you can sign up to those. There's always free things to collect on the way around as well. Games. It's a hive of activity in the first couple of weeks. Vouchers picking up, for discounts for shops in the local area. So there's a lot going on in the first couple of Freshers Week. None of it's compulsory, but if it's something you want to get involved in, then there's definitely something for everybody. You don't do a dissertation with the BSc because we have enough credits for our 3 years that you don't have to do a dissertation in for our Bachelor of Science, which I know is different to some other BSc courses that you may have seen, but we have a lot of taught content and assessments that make up for the credits that were previously allocated to the dissertation. So that's quite, in some respects, a positive for some people. How many people in a class lecture? So if you're Bachelor of Science, we have 142 per year is our number, give or take. So they're big classes. And as I said, sometimes you're split into smaller groups within that class. You might be doing some group work, seminar work, or in the skills labs, you will be in smaller groups. We can only have a maximum of 16 students at a time in the skills labs because that will get too busy in one time. And as I said, Lucy, you're merged when we do the interprofessional modules. You will be merged with mental health, learning disabilities and adults to complete those courses. So the communication module is an interprofessional module.